So here's a common question I get asked. What thyroid medicine should I take? Should I be taking the natural thyroid medicine? Should I be taking compounded? Should I be taking the synthetics? Hi, I'm Dr. Chellam, founder of Holistic and Integrative Center of Novi, our holistic icon, the best place for you to find your best doctor, and that is always you. Before we get into what should you be taking, really the question you need to ask is, why do you have a thyroid problem? A lot of times, yes, we know commonly diagnosed one is Hashimoto's, an autoimmune thyroid condition, but that's an immune problem. There are times when the thyroid actually does not work, and despite taking medications, people still have symptoms, particularly dry hair, dry skin, and they've been told they don't have Hashimoto's. So what's really happening in their thyroid? This video is really directed to those patients. So for you to understand how the thyroid works, remember when the thyroid hormone levels go down, the brain stimulates the pituitary gland to produce TSH, the thyroid stimulating hormone. It is through a hormone called TRH. And TSH stimulates the thyroid to produce more thyroid hormone. What are the steps that go into the production of the thyroid hormone? Iodide gets drawn in from the diet. It couples with the amino acid tyrosine. Now the two together form the thyroid hormone, and that is this combination of iodide with tyrosine is affected by TPO, an enzyme. Now once the thyroid hormone is formed, you get two major thyroid hormones formed. One is the T4, which is 85% of your thyroid. The remaining 15% is T3. Interestingly, T4, the number 4 indicates 4 iodine molecules. It locks down this thyroid hormone, so it's the inactive hormone. T3 is the active hormone, and from T4, when one iodine molecule is removed, it unlocks it and helps the thyroid actually work at the cellular level. How does it get unlocked? It requires an enzyme which is called deiodinase. So it's deiodinizing, taking out the iodine. In the body, for every hormone and enzyme action, we have the main enzyme, the main hormone. They're called the pilots. Think of them as the pilots. They need co-pilots or cofactors. What is the cofactor for the deiodinase? It is usually iron, zinc, and selenium. If you're deficient in these, this conversion to the active hormone goes down. And that's why giving more of the T4, which is the synthetic version, levothyroxine or Synthroid, does not help, because if it's not getting activated because you don't have enough of these, you still are going to be hypothyroid. So can we do T4 and T3 combination? Here's what you need to understand. How does the thyroid actually work? It affects every cell in our body. And the way the T3 does is it goes to the cell, doesn't work from the outside of the cell, but goes to the brain of the cell called the nucleus, in which the cellular genetic material is there. So the DNA actually has to open up and translate this genetic material into proteins. That happens only when the thyroid knocks on the DNA. And there again, it needs the cofactor or copilot, which is vitamin A. So if you're deficient in vitamin A, you will find that the T3 cannot work effectively. So even though you may give T3 and T4, if you're not addressing these issues, you have a problem. People who are iron deficient, very common in young women who have heavy menstrual periods, and during their menstruating years, they're kind of subclinically anemic. They don't like to take iron because it causes constipation. Similarly, zinc and selenium can be due to an absorption issue. Vitamin A can be due to an absorption issue. So without addressing these, just giving the T4, T3 may not effectively control your symptoms or effectively replace what you're lacking in terms of thyroid. Now, there's another more important step. Remember I said when the thyroid stimulating hormone asks the thyroid to produce more hormones, the iodide gets pulled in from the diet. You'll find thyroid issues are very common in people of the Mediterranean origin and the Asian Indian population. The reason for that is their food is very high in what we call thiocyanates. Thiocyanates is very rich in the Mediterranean because it actually prevents sickle cell crisis or sickle cell anemia. And sickle cell traits and thalassemia traits are very common in these countries. It protects them from infectious diseases. However, when you are very rich in thiocyanates, what happens is it reduces the amount of iodide that gets pulled in from the diet and therefore reduces the production of thyroid hormones. What are thiocyanates? What are the foods that are rich? Lentils, chickpeas, cabbage, carrots, cauliflower, cashew, plantains, cassava. This is not an exhaustive list, but you can see how some of these cultures that are very rich in this kind of a diet tend to have an inhibition of the iodide from the diet. So if you're very rich in thiocyanates, the chances are your thyroid hormone is not getting effectively produced. If you're rich, if you're kind of poor in the absorption or a greater loss of these micronutrients or minerals, you most likely are not converting or getting active thyroid. And if the active thyroid is present enough, but you don't have enough of vitamin A, then the function at the end level, at the cellular level, does not happen. I hope this makes a little more sense. So before you jump into figuring out what thyroid medicine you should be taking, look at where the problem might lie. I'm Dr. Chellam, once again, founder of Holistic and Integrative Center of Novi, the best place for you to find your best doctor, and that is always you.